I am Dr. Saqib and today I'm taking up this neuroanatomy topics, the blood supply of the brain, and we'll discuss it in detail. And the main, two vessels involved mainly, which is the internal carotid artery, and the other one is our vertebral artery. So two arteries mainly are involved. You see where is this internal carotid artery. So this is the line. This is the common carotid artery, and it divides into external carotid and this internal carotid artery. And this internal carotid artery not subserving anything in the neck, and it goes into the cranium, right, where it will give branches and will take part in the formation of the circle of Willis. Circle of Willis, very, very important for the blood supply of the various areas of the brain. So we'll talk in a while. So this is the entry of the internal carotid artery. Recall the knowledge of the skull anatomy from the head and neck, and you will come to know how this internal carotid artery enters the cranium. What is the relation to the various foramina, like the foramen lacerum or that. And then the other artery is the vertebral artery, right? This is the vertebral artery. You see this, and this is coming from this, which part? This is the subclavian artery. So subclavian artery gives rise to vertebral artery. Of course, this is passing through the foramen transverse area. Vertebral artery is very important, first of all, for the blood supply of the spinal cord, because it gives the anterior spinal arteries and the posterior spinal arteries. We'll show you later on, very soon. Well, we'll discuss the blood supply of the spinal cord separately. So now today we'll focus on the blood supply of the brain, various parts, the formation of the circle of Willis, and also the veins of the brain. So which veins we've already done in the semester of the head and neck, dural venous sinuses. We'll repeat quickly. So this is passing through the foramen transverse area. These are the cervical vertebra, and they contain the foramen transverse area, and the vertebral artery passes through that and goes upwards. And you recall from the brainstem knowledge that at the brainstem, two vertebral arteries, so right and left, unite to form the basilar artery. Of course, there is the basilar groove. Which one the part is the basilar groove? Recall in your mind, basilar groove. Of course, basilar groove is lying on the anterior surface of the bones. Basilar artery is there, which is dividing into posterior cerebral arteries. Posterior cerebral arteries, which is contributing to the formation of the circle of Willis. Here you see, this is the internal carotid artery branches. Internal carotid artery branches, and we will enumerate them. I have enumerated these for you. Branches of the internal carotid artery are the ophthalmic artery, the posterior communicating artery, the choroidal artery, the anterior cerebral artery, and which has two branches: anterior communicating artery, cortical branches, central branches, and the middle cerebral artery, which has the cortical branches. These are the branches of the internal carotid artery. And the vertebral artery branches. First of all, branches of the vertebral artery in the cranium, cranial portion, right? This is because it also gives branches in the neck. So meningeal branches in the cranial portion, in the cranium, skull. Meningeal branches, posterior spinal artery, anterior spinal artery, all that I told you. This is the branches which subserve the blood supply of the spinal cord. The posterior inferior cerebellar arteries. This is very important. I told you pica, posterior inferior cerebellar artery. Pica syndrome, I told you, this is the lateral medullary syndrome in the lesion of the medulla, which we talked in detail already on the lecture on the medulla oblongata. So, which is already discussed with you in detail. So then the last of all is again the medullary arteries. So these are the branches of the vertebral artery. Then as the basilar artery is formed, you see I rather resort to this picture as this point to this. Let me rather enlarge the picture for you here. It will be helpful for us to enlarge it. Yes, you see, these are our these vertebral arteries, right? These are the vertebral arteries, right and left vertebral arteries, and they unite to form this is the pons and the basilar groove. They form the basilar artery, right? This is the vertebral artery. I told you various branches of the basilar artery, and like again you see this is the pontine branches. But lying on the pons, we go to pontine branches. And as this basilar artery ends at the level of the pons, it divides into two branches, which are the posterior cerebral arteries, right? You see this. This is the division of the vertebral artery, and this is the basilar artery dividing into various branches. Basilar artery. See, focusing on the posterior cerebral artery. You see the broad spray, posterior cerebral, and you will learn anterior cerebral, middle cerebral, and posterior cerebral, supplying the various part of the cerebrum in a separate picture. This is right. So this is over this, and as a following system, so I will tell you the branches of the basilar artery, which is the pontine arteries. I told you already. Then the labyrinthine artery. They will be coming one by one as I just teach you the various portions of the brain and the blood supply and the venous training, and the anterior inferior cerebellar artery. This is the ICA. So superior cerebellar artery and the posterior cerebral artery. This branches of the basilar artery. So this is very important and interesting. First of all, before I move to the formation of the circle of Willis, and I think this is more relevant. This area supplied by the cerebral arteries. All you got to know is where it comes from: the anterior cerebral arteries, posterior cerebral arteries, the middle cerebral arteries. If you recall, come back, this is the basilar artery, gives a posterior cerebral artery. Then coming back, this is the, you know, our vertebral artery. So this you see at this branches, and this is the internal carotid artery, gives the middle cerebral artery and the anterior cerebral artery. So in the cerebral arteries, internal carotid contributes to anterior and middle cerebral arteries, and the basilar artery contributes to the posterior cerebral artery. So these three branches are involved. This medial and this is the lateral aspect of the cerebral hemisphere, and this is the medial aspect. These three branches are shown in these different three colors, and you can go back to trace the colors, remember the colors, and you can draw and label them in your notebooks to remember that. Very simple. So we'll of course start anteriorly. So this is the medial section. This is the anterior cerebral artery. So this is the color blue, and this lies from here, this area, the frontal lobe pole. This is the anterior aspect of the brain. This is the frontal pole. Posteriorly up till this level, this is, you know, is the humerus. Before in front of that, this area is supplied by our anterior cerebral artery, and in the lateral aspect, this upper border here, this from this you can say frontal pole here back to the superior frontal gyrus. Then this is central sulcus. You have studied already cerebrum, so you know the various these terms. This is superior parietal lobule up till this level, which is a parieto-occipital sulcus. This is supplied by the anterior cerebral artery. And then coming to the second artery, so anterior cerebral and the middle cerebral branches of the, what you see from this picture, our this middle internal carotid artery, branches of the internal carotid artery, and the posterior cerebral is a branch of the basilar artery. So first we discussed already the anterior. Coming to middle cerebral artery, and this is the large area on the lateral aspect, the outer aspect of the cerebral hemisphere, supplied by the middle cerebral artery. You see like this, and some inner aspect, medial aspect, this area here, right? This lobe over here, below. So this is the is supplied by the this is the temporal lobe. So this is supplied by the this middle cerebral artery. So one is remaining this that is the this is a posterior cerebral artery, which is coming from the basilar artery. So this is the medial aspect, large part of it. This below this is a temporal part, and you see this, and this is coming to the occipital part, and up till this cuneus. So this is the area in front of the supply of the our anterior cerebral artery. This is supplied by the posterior cerebral artery. The small portion here, the posterior occipital sulcus, behind that occipital lobe, and up till this inferior temporal gyrus, and up till this till the temporal pole. This is supplied by this posterior cerebral artery. This is just the drawing, very important. It's exam question. Let's focus on the circle of Willis. First of all, you remember the 6 arteries in the formation of the circle of Willis. What are they? So that is you can get a question and write down the 6 vessels or 6 arteries forming the circle of the Willis. This is the anterior communicating artery, anterior cerebral artery, internal carotid artery itself, posterior communicating artery, and the posterior cerebral artery, and the basilar arteries itself, right? So these are the 6. You remember the name, and you know, identify these structures in this picture. This is the circle of Willis. This is present. This is you've taken from the textbook. So you see, this is the basilar artery, right? And this is the circle of Willis, right? What is this? This part of the brainstem is the midbrain, and midbrain it says the structure in the midline, which is not part of the midbrain. That is the interpeduncular fossa. You know, there are the peduncles of the midbrain and the interpeduncular fossa with the posterior perforated substance. It contains a circle of Willis as well, along with the oculomotor nerve, right? So this is the circle of Willis present in the interpeduncular fossa. So how you see it is completed and formed. So posteriorly stored, first of all, is the basilar artery, right? This is the basilar artery. Then what? Posterior cerebral artery. Then next, posterior communicating artery. Then what? This internal carotid artery, both right and left on this side, right? And then what? This anterior cerebral artery. And this is the last, this is the anterior communicating artery. That's it. These are the 6, and you have to complete. You can draw and label the circle of Willis. You have to know that. So this is a point, the circle of Willis formation, very beautifully explained in this picture. And written over here, these 6 branches, you can follow that, trace that. I've told you this is itself a circle. This is a circle, right? So then the middle cerebral arteries. Right, I told you this is the area supplied by the our you know, middle cerebral arteries. Yes, this laterally and some portion medially. So this is the detail, right? Coronal section, and shows arterial supply to the deep cerebral structures from the middle cerebral arteries. So what are they? These are the lentiform nucleus, and these are the arteries, the cerebral arteries. They give the striatal arteries. So this is the thing. So it's flying like this is the chordate nucleus. This is one of the basal ganglia, the basal nuclei. Like this is the lentiform nucleus. So these are the lateral striate arteries, right? So these are the various branches flying the deep structures in the cerebrum is the basal ganglia, and these are the collections of the gray matter present within the cerebrum, white matter. So this is noted the basal nuclei or the basal ganglia. This is lateral striate arteries coming from the and the medial striate arteries. Medial striate arteries and the lateral striate arteries coming from this middle cerebral arteries. This is left and this is the right. So that arteries with specific brain areas. This I told you many times that the medulla, pons, and midbrain. I've already told you in separate lectures. We'll repeat that. So the corpus striatum and the internal capsule are supplied mainly by the medial and lateral striate central branches of the middle cerebral arteries. Showed you these medial and lateral striate central branches in the previous diagram, that the corpus striatum, these are the various portions and names of the basal nucleus, the lentiform nucleus, chordate, putum, and these are we learn in the basal ganglia, and the internal capsule nerve supply fiber. Capsule of the internal, blood supply of the internal capsule is very important. The central branches of the anterior cerebral artery supply the remainder of these structures. Thalamus, already done thalamus, this blood supply. Repeat, posterior communicating basilar and posterior cerebral arteries, and the midbrain, again repeating, posterior cerebral, superior cerebellar and basilar arteries. And again, this is next picture. This is forms by the basilar and anterior, inferior and superior cerebellar arteries, medulla, vertebral, anterior and posterior spinal, posterior inferior cerebellar, pica, and basilar artery. Cerebellum already done. Superior cerebellar, anterior inferior cerebellar, and posterior inferior cerebellar arteries. And this was about the arterial supply. Let's move to the venous drainage and the venous aspects of the veins. So this is to have to recall the knowledge from the head and neck semester, which you've declared. So you see, this is which aspect? This is the lateral aspect. This is the medial aspect of the brain. Let's just see the lateral aspect. What is this structure? Dural venous sinuses. Dural venous sinuses. This is second year studies. It's superior. This is the one of them is the superior sagittal sinus. Dural venous sinuses are formed folds of the dura in relation to them, and lined with the endothelium and the valvulus, and no muscle in their walls. And this is they contains the venous blood. This is the dural venous sinus, superior sagittal sinus. And then shown is superior cerebral veins, that is occipital pole. This is the confluence of sinus, to recall that. And very important, this is a transverse sinus, and this is going into the formation of the sigmoid sinus S shape, which turned into the internal jugular vein, which is responsible ultimately for the whole drainage of this cerebral hemispheres to the neck. And this is the internal jugular vein. So this is the superior sagittal sinus, a great cerebral vein, internal sagittal. This is the inferior sagittal sinus, superior. This is the formation and relation of the fox cerebri. You recall the dural folds, and this is inferior pre-margin, and this is the attached margin. If you recall, this is the crista galli level, and up till this confluence of the sinus, the internal occipital pubis level. And these are the basal veins, very important. This is the basal vein, right? This is the straight sinus, and this is the internal cerebral vein. This is forming the straight sinus. The four sinuses meet here, which is the confluence of sinuses, right? So this is the venous drainage. So external cerebral veins, what are they? Superior cerebral veins, and the superficial middle cerebral vein, and the deep middle cerebral vein, right? Interior cerebral and striate veins form the basal vein. This is the, I showed you already, this is the basal vein here, showed you already. So that is the internal cerebral veins. They are the two internal cerebral veins, and they are formed by the union of the thalamostriate vein and the choroid vein at the interventricular foramen. You've studied this ventricular system, and you know what are the interventricular foramen, where it is. And the two veins run posteriorly in the thyla choroidea of the third ventricle and unite with the splenium of the corpus callosum to form the great cerebral vein, which empties into the straight sinus. So veins of the specific brain areas. Midbrain, drained by veins that open into the basal or great cerebral veins, spawns into the veins that open into the basal vein, cerebellar vein, or the neighboring venous sinuses. Medulla, drained by the veins that open into the spinal vein and the neighboring venous sinuses. The cerebellum, drained by the veins that empty into the great cerebral vein or adjacent venous sinuses. So with this, that discussion of the system of the or blood supply of the brain to the various portion, when it very quickly, and I can repeat it for you. Just I think that would be appropriate for you. So right, so two vessels, two arteries, internal carotid artery, right? This is the internal carotid artery. See my red laser. This is internal carotid artery. This is discussed very in detail with you. This is the vein, and this is the vertebral artery coming from the subclavian, going like this in the vertebra. This is going up to the unite right and left vertebral arteries unite at the front of the pons, basilar groove to the basilar artery, and then internal carotid artery branches that you can of course revise from any book or from the notes. You can re-listen to my lecture here, so whatever is your choice, right? So repeated these written over here. You can see, you can pause the recording and pause the lecture. This is the video. So this will come to know the branches of the cerebral portion and the vertebral artery branches, right? This told you already, more focuses on the anterior spinal artery and the posterior spinal artery. And in the internal carotid artery, very much focuses also on the anterior cerebral artery, giving the anterior communicating and the cortical branches and the central branches, especially the anterior cerebral artery with its anterior communicating artery, as it is for formation of the importance in the formation of the circle of Willis, and then is a middle cerebral artery. This is the internal. And the basilar artery, these are the branches. This is a very important picture. I've got to draw and label it and just to memorize it. So area spread by the cerebral arteries. This is the lateral aspect of the cerebral hemisphere, and this is the medial aspect. Medial aspect, how will you remember? These structures are present over here, like this is the corpus callosum, right? This is the diencephalon here, right? That will tell you this is the medial aspect. So just memory tip. So this is the circle of Willis. I told you already, very six arteries taking part in it. This is the circle of Willis. I told you already. You can go back to the recording of the video and learn that these are the six arteries taking part in that formation, right? So I told you already many times. This is the middle cerebral artery, giving this medial and lateral striate arteries, which are responsible for supplying the basal nuclei and the internal capsule, striate arteries. The pons, medulla, and cerebellum and midbrain. I told you already in the separate lectures. I told you again today. These are the previous knowledge from head and neck. I repeated that even, which is shown in this your neuroanatomy, right? Neural venous sinuses. You could go back to some lecture and whatever is your easy mode book even. It's the neural venous sinuses, little bit detailed. So right, you know, these are the confluence of sinuses, various sinuses in the neural folds. Told you the definition. Meet at the confluence of the sinus, with the transverse sinus comes into the sigmoid sinus, and all of these veins, the venous sinuses, come into the internal jugular vein. Of course, you know, this comes into the neck, and ultimately the fate of these internal jugular veins like these is the like into the superior vena cava, you know, into the right atrium of the heart. So external cerebral veins, these are three: superior cerebral, superficial middle cerebral, and the deep middle cerebral vein. And the internal cerebral vein, the thalamostriate and the choroid vein. This was both the midbrain, pons, medulla, and cerebellum vein. I told you already. And I thank you very much again for this listening to my lecture. I'm very thankful to you. Take good care of you. Stay safe. Stay home. And let's continue with this online learning. And good wishes for everybody. Everybody stay safe. Everybody be healthy and safe. Best of luck.